For children with epidermolysis bullosa, or EB, every day presents a battle against constant pain. Shockingly, nearly half of children with severe EB live with daily pain rated over 5 out of 10. Only 5% are ever pain-free. This isn't temporary. For these children, intense pain starts almost at birth and persists for life. And it is not just skin pain. It is a complex assault from wounds, joint deterioration, and internal damage. We will reveal the biology driving this pain, expose the barriers to relief, and show the integrated strategies that truly work. First, we must understand the scale of this problem. Pain in children, particularly infants, is dangerously under-recognized. For kids with EB, this is magnified. But why is their skin so sensitive to the slightest touch? The reason is genetic. This challenge is greatest in newborns. They cannot tell us where it hurts, forcing caregivers to become detectives of distress. The pain is not just physical, it is psychological. Children with EB develop severe anticipatory anxiety before dressing changes. This constant cycle of pain and fear has a devastating emotional toll, leading to anxiety, depression, and social withdrawal. So, we have physical pain, procedural pain, and deep psychological distress. Now, we'll explain the biological cause for its intensity. We asked why EB skin is so sensitive. The answer is a molecule called laminin 332. In healthy skin, it acts as a brake on touch signals. The genetic defect in EB removes this brake. Without laminin 332, sensory neurons grow uncontrollably, creating an overabundance of nerve endings. This means their nervous system is physically rewired for hypersensitivity. This is why standard pain management often falls short. Because of this wiring, another principle is vital. Intervene early. It is far better to manage pain before it becomes severe. This complex biological and psychological reality demands more than a pill. The gold standard is an integrated biopsychosocial method. We know their pain is real, multifaceted, and biologically amplified. So what does this integrated method look like in practice? It begins with non-drug interventions like physiotherapy, occupational therapy, and adapted yoga to manage joint pain and mobility. Psychological tools are equally vital. Cognitive behavioral therapy and distraction techniques like virtual reality can alter pain perception. Direct wound care is another key front. Non-adhesive dressings protect skin, while isotonic salt baths can reduce procedural pain. For infants, intranasal medication gives rapid skin-harmless relief. Topical morphine gels can also be applied directly to wounds. With so many options available, why does undertreatment persist? The answer lies in systemic barriers and damaging myths. One major barrier is the healthcare system. Providers face trouble evaluating pain in nonverbal children and lack specific EB knowledge. A second huge barrier is fear of opioids. Pervasive myths about addiction lead to underprescription, even for the most severe pain. The evidence shows that when used correctly for severe pain in this context, addiction is rare. Withholding comfort from fear is a mistake. New research is showing that some botanicals can improve pain scores and reduce the itch. Ultimately, these individual barriers point to a global need for standardized pain management guidelines and better provider education. Let's connect the pieces. A nervous system hardwired for pain creates intense anticipatory anxiety. One pill cannot fix both. This integrated method is not about end of life. It's a philosophy to maximize quality of life from day one. Palliative care proactively manages symptoms like pain and itch. It also addresses the family's psychosocial and spiritual needs. So the solution is not one magic bullet. It's a continuous, adaptive, and deeply compassionate strategy that begins at diagnosis. Effectively managing pain in children with EB is not just possible. It is a moral imperative demanding a multifaceted approach. For parents and caregivers, be a relentless advocate. Demand an integrated plan and know you are the authority on your child's pain. For healthcare professionals, challenge your biases on pediatric pain and opioids. Learn EB-specific strategies and use palliative care early. By understanding the science, dismantling the barriers, and working as a team, we can change the story of pain for children with EB.